lost were extraordinary. They spanned generations. Born in America, immigrated to America. But just like that, so many of them took their final breath alone in America. As a nation, we can't accept such a cruel fate. While we've been fighting this pandemic for so long, we have to resist becoming numb to the sorrow. We have to resist viewing each life as a statistic or a blur or on the news. We must do so to honor the dead, but equally important, care for the living, those who left behind.
Stay in the US and go to Texas and speak to Angela Clendenin, who joins us from College Station. She's an epidemiologist at Texas A&M School of Public Health. Welcome to the program. Now, this really is a very grim milestone. How long before the vaccines start to make a difference to those death numbers?
It really is going to take some time before we see any kind of impact of the vaccine on both daily case counts as well as fatalities, because it's the logistics of administering and distributing the vaccine. It is getting people to agree to get the shots in their arms. And we're looking at needing to have anywhere between 80 to 85% of our population fully vaccinated, whether it is with a 1-dose vaccine or a 2-dose vaccine, before we can see any kind of impact.
And Dr. Anthony Fauci, he spoke about the political divide, and he said it added to the stunning death rates. Do you think that this death toll could have been avoided?
I agree with Dr. Fauci that early on, some of our public health behaviors that we were advocating for, the mask wearing, the physical distancing, good hand hygiene, avoiding crowds, trying to balance that with the needs of the economy and keeping people working, it did become politicized. And it's too hard to speculate on how many deaths could have been prevented if the whole system had not become politicized. But I think at the end of the day, just like President Biden said, we need to make sure that we're not just looking at these deaths as a statistic, but as somebody who's very important to someone.
And you're in Texas, one of the hardest hit states. How is the state coping?
So our state has been hit pretty hard, not only by the fatalities. We have several densely populated metropolitan areas. Interestingly enough, looking at some of the genetic sequencing of the variants, we learned that the first big surge of coronavirus in Texas was a very different variant than the second big surge and very different than the third surge. And some of these variants are more transmissible, which then leads to increased caseloads. On top of that, we had our big winter storm for a week that shut our state down for a week. We're not used to ice and snow. And we're kind of flying blind as to whether or not we're going to see an increase in cases due to this shutdown, or if we're going to be able to see a decrease. So the next 7 to 10 days, I think, are going to be very telling about the direction that Texas is going to go.
Angela, thank you so much for speaking to us today. Angela Clendenin.